Greetings and welcome to another edition of Montpelier Connection. We're in summertime mode here, but we're still looking to connect with people from the Windham County area and especially Brattleboro people. So my name is Mike Mrowicki. I'm the state representative for the new and improved Windham 4 district of Putney, Dummerston, and Westminster. And today's guest is State Senator Jeanette White.
Thank you. Representing the unfortunately decreased Windham Senate District because we no longer have Londonderry as one of our sister towns. They'll be in Windham County for every other purpose, but they are now part of Windsor County for purposes of the Senate districts.
And being a session after the 10-year census, we have gone through a reapportionment.
Right.
And, I think compared to other states, we did pretty well.
You know, yes, and thank you. I chaired that committee in the Senate. Thank you for mentioning that.
Yeah.
And the time has passed for a suit under the state. There still might be opportunity under federal, but I think that it's been decided that since there is no time limit for the federal suit to be brought under federal law, that we go by the state law, and so we're in the clear. So we don't have. New Hampshire had a whole bunch of them.
They did. New York's had some trouble. I think in Vermont, in the House, there was a lot of tripartisan work, and the final vote in the House was, I think, 130 to 4, and in the Senate.
You know, I don't remember what the final vote was. I believe it was unanimous, or it may have been 29 to 1.
Yeah, pretty strong vote.
But it was pretty strong vote.
Whereas in other states, things are more contentious.
Yeah.
And looking at states around us, New Hampshire, New York, makes Vermont look like the Sea of Tranquility in the way the legislature has effectively been performing our job.
Right.
There's a primary coming up, then a general election in November, and one of the things that will be different this year, something you had something to do with.
I did. 4 years ago, actually, 3 young women came to me as chair of government operations, and because we deal with elections, and said they wished they had been able to vote in the primary to help their parties, and it turns out they were of different parties, elect the person who was going to be their candidate in November. But they couldn't, because in Vermont you have to be 18 years of age in order to register to vote. And it would take a constitutional amendment to change that. So we did it. I worked with this young woman, Katie Lavasser, to get the constitutional amendment changed. And in Vermont it's hard to do that.
Yeah,
it first has to pass the General Assembly one biennium, and then the next biennium, when you have new members, it has to pass again, and then it goes out to the general population for a vote. And I think it passed something like by 80% or something. It was very exciting. So that means that if somebody will be 18 by, what's the election date? November 6th? Should we look at our calendars? I think if they'll be 18 by then, they can register to vote in the primary, which is August 28th. That's very exciting because it is really important to get young people involved at an age when they get excited about it.
You bet. Yeah. And we have been working in Vermont on a number of levels to make the ground fertile. You know, one of the things that we've been doing on the House side is encouraging the non-gray-haired set, and I think we've achieved a good balance. And like any team, it's good to have some new blood. It's good to have some experienced, seasoned people, and I think we're moving in that direction.
Yeah. And just get them excited about voting and out there and working on issues.
Yep, we have locally, you know, one of our delegation members is Matt Trieber from Bellows Falls. Been doing some great work. He's just 30, I think. And we have a number of people of that age, and
you know, their involvement does make a difference. I'm sure you remember the CLIA effort down here, and to get the state to stop buying things that were produced in sweatshops. And I think it passed, and the governor signed it. That was 4 years ago, I think. And I think a lot of people thought that it was just a feel-good measure, but in fact, and I don't know what how many of them, but I did ask Michael Bohosky after he was named Commissioner of Buildings and General Services, and in fact, a bid for contract to provide, I think it was prison uniforms. It was some clothing item anyway, was turned down because they wouldn't guarantee that. They weren't buying from sweatshops.
With child
so
labor.
it works.
Well, it's interesting to see how those issues evolve too. We were both recently at the Governor's Institute as another way of us trying to outreach to high school students and new voters, and it was interesting to see what was important to them. The first group I was with wanted to talk about education funding and state involvement, and the next group wanted to talk about how do we create more diversity in Vermont.
Interesting. And our groups talked about the overpopulation of our prison system and how do we deal with that. And that actually led to decriminalizing or legalizing marijuana and how our drug laws aren't working. And the second group talked a lot about, well, they talked a lot about a lot of things, but one of the things they talked about was a bill that I have in there that somebody knew about, I guess, which is a student-free speech bill. And so And
it's another way that I think we're all enlightened by those kind of interactions. And I'm very optimistic for the future, and it was nice to be around people that are likewise. The students, for the most part, are very optimistic about their future and can't wait to get at it and be a bigger part of what's happening.
Right, and they're very bright young kids, and
Well, the decision-making process will continue, and there was a very important decision that affects Vermont. The Supreme Court of the United States rendered recently, and I wonder if you have any thoughts about that.
Well, just that I think that now we can breathe a slight sigh of relief that what we're doing would continue. Right, what we're doing in Vermont would have continued to go ahead anyway, and I think that we're so far ahead of even what the national legislation is around healthcare that the difference to us was going to be if it was struck down, then we would lose that subsidy for the people of limited income who are buying insurance policies. But I can't believe that there are states out there that are saying they're not going to set up their own health exchange. That means that the federal government is going to come in and set it up for them. I mean, if you're going to have one, wouldn't you rather have control of it yourself?
You would think. It's
I would think.
Hard to understand. But it's interesting. Dinosaurs die hard. And I think our current healthcare system is a dinosaur that is dying hard, and there are a lot of people hanging on to its legs. But the reality is it's unsustainable. And for the most part, what we're trying to do is get more and better access for people and control costs.
Right.
And I think those two things can actually go hand in hand as we move forward. And I think that Vermont is really on the cutting edge of creating more and better for people, rather than what's happening now is people are paying more and more for less and less, and that's not a sustainable dynamic either.
It isn't, and I think that in a small state like Vermont that we can have better cooperation. I mean, we have a lot of vested interests in the healthcare system. We have the pharmaceutical companies, the durable medical products companies, the medical society, the insurance companies, all of those. But on a lot of the reforms that we've been making already, they're playing. They're part of it because they see the writing on the wall, and so they really are there. The insurance companies have stepped up to the plate around the community health teams.
Especially
they're funding those. No, they're all funding them. The community health teams are funded equally by MVP, Blue Cross, Medicare and Medicaid, and then Cigna has a very small
They have a small
because
market
they have a
share.
small market here. So, but it's great that they're all playing the game.
Well, it's clear to me moving forward, we have to ensure that our healthcare dollars get spent on healthcare.
Yeah, yeah.
And when the subject of money comes up, I believe we're already spending enough money. We just have to make sure those dollars go for healthcare.
Right, right.
And that's probably the big
Right.
change that's going to happen.
Well, and this year is going to be then how do we finance it? And I think there's a lot of misinformation out there about how we finance
That's right.
this, and we have to be really careful that people get the right information.
There's not going to be
It's-
an increase. What's happening is we're just going to spend the same amount of money or even less. So the misinformation that's going to go out there is probably that talking about big tax increases or spending more money. The reality is we're going to be spending less, and it's going to be more efficiently spent.
Well, and I think that when we were at the chamber breakfast the other morning, one of the questions that came up was, if we have a payroll tax to pay for this, I can't afford a payroll tax now because I'm already paying all these taxes and I'm already paying my premiums and I can't afford any more. The payroll tax is going to replace the premiums, and and it's going to redistribute it so that the good guys that are providing the insurance
That's right.
now and are paying those premiums, they're paying, part of their premium is going to cover the people who aren't covering their employees at
right.
all. So it'll be more evenly distributed, and
It'll make for a level playing field.
it will.
too.
It will.
Let's say two companies bid for
Exactly.
a similar job. One of them's providing health insurance,
Right.
the other isn't. Someone has an advantage there, and that's not equitable.
And then the people that aren't providing it, in lots of cases, we're providing it anyway because their employees are either on VHAP or Dr. Dinosaur
That's
or
right. Or using the free clinics.
using the free clinics. So
free care
so I hope
hospitals.
that we can get the right information out
Yep.
there to everybody.
Well, that's our
and
job, and one of the reasons
that's our job.
That is.
You're right.
One of the other jobs that you've been involved in is to make government more effective and efficient, and that's been an ongoing committee. What are some of the things you've been looking at, and going into the future, what do you think we should be looking at?
Well, it is a very interesting committee, and it isn't a regular standing committee of the legislature. So we meet once a month all year long. And what we're looking at is how do we look at what we're doing in order to get the results that we want. Because, so here's an example that's used. Your goal is to reduce teenage pregnancy. So you have this great program, and they come in and they're serving 100 kids. And they come in the next year for their funding, and they're serving 125, and so they need a 25% increase in their funding. So the way we've funded before is kind of like that. Mm-hmm. And so what you should be asking is, you should say, are you decreasing teenage pregnancy? Well, no, we're not really decreasing teenage pregnancy, but this is such a great program. It's building self-confidence in kids. It's doing all this kind of stuff. But if the outcome here is to reduce teenage pregnancy, maybe we shouldn't be funding you under this. Maybe we should fund you under something else,
right,
but not under this goal. So trying to look at how do we evaluate programs and to make sure that they're doing what they're supposed to be doing, they're getting the outcomes that they should be getting, and then making sure that we're being efficient in the delivery of that, so that we're not duplicating things from agency to agency or department to department. And and our goal is not to decide whether the best way to reduce teenage pregnancy is by education and putting condoms in the high school, or by abstinence. That's for the administration and the legislature together to decide how they're going to do it. But if it's been decided on that that's an outcome, our goal is to set up a system for evaluating it, so that we can always make sure that whatever program we're using, the system is there to make sure we're getting the results.
So you'll be setting the indicators for whether they're hitting their outcome?
Where the outcomes have been set by the legislature and the administration. The measurements have pretty much been set. And now we have to set up a system to make sure that that is always paid attention to, and that when the budgeting is done, and we have a lot of interesting discussions on our committee, because some people think that we should be endorsing legislation that we think is more evidence-based, or that we should be only funding. Ours isn't to decide what, it's to decide how, or if that makes sense, but to look at a system for evaluating and not what it is, because you elect a governor every 2 years and legislators every 2 years, and you have to pay attention to what their visions are and what they've been elected by people, so we can't second guess that. So
speaking of governors, we've had 2 years now with our friend and neighbor,
we have
Governor Shumlin, and thoughts on how he's doing, how we're doing working with him?
Personally, I think he's doing a great job, and I think that one of the things that he did was so brilliant was to appoint good people.
Yeah.
And that makes a huge difference. And there were a lot of good people in the Douglas administration, but I think Peter has really appointed some thoughtful, good people in the positions. And I think he's doing a great job. And somebody said something to me the other day, and I don't remember what the issue was, and said something about it was just the governor telling the Senate what to do. And I said, make no mistake about it, the governor does not tell the Senate what to do.
There's clear lines between the administration and the legislature. And
there are issues on which I've completely disagreed with him, and have gone in and said, I think you're wrong on this one. He's caved on some of them, and I didn't get my way on others.
Yeah.
So,
the state hospital is a good example where there was a compromise needed, and I think the governor led the way for us not to get stuck, because it was too important not to let that moment get away from actually not having a state hospital anymore the way we did, a large institution, but really reforming how we deliver health care for those Vermonters who are experiencing mental illness.
Are you on the Mental Health Oversight Committee?
Not yet.
You're on Health Access?
I am.
Okay. I was wondering, because we have a meeting on next Friday.
Well, I think it's a place I'm headed for, according to my chair.
Oh, okay. So are you going to be there next Friday?
No, I won't, but this is in the future.
Oh, okay.
I think I'm going from one committee to the next.
Okay.
One of the standing committees. Looking ahead next year, we've got a few minutes left, both from our perspective and for the governor. We were somewhat challenged this year, to say the least, by the floods dominating the legislature, and then still trying to move forward with our agenda of providing health care, looking at how we can address global climate change and affect a new energy future here. And I think one of the things that talk about painting a difference between the two administrations was the Governor Shumlin's announcement this week to put more into pedestrian and bike paths.
That was great.
As a way to recognize that these are all parts to an energy future and a more healthy future for Vermonters. Moving forward, do you have any ideas that you'd like to see us work on, or that you want the governor to hear about now?
Well, I'm constantly sending notes to the governor about things that I think that we should be paying attention to, but I think that the two big issues probably are the moving forward with health care, and then the creation of jobs. And I think that we need to be very careful, and I think we have been we've become more careful, that we don't want to we're not interested in bringing in a company that's going to have 12,000 employees in Putney and paving over the entire field
and paying minimum wage.
What we're interested in is helping companies that already exist grow and provide those good jobs. So I think that that's going to be a huge focus, and I think we did, and included in that is the working landscape, so that we focus on agricultural jobs and value-added jobs. I think we made a good start with that last year, and I think we're going to keep working on it. I personally have bunches of issues that I want to work on next year. I think we need to look once again at our decriminalization of marijuana, the penalties for...
Now, attendant to that, last session, we passed a law to set up dispensaries.
We did.
Right? And how's that progressing?
That is progressing. The rules were all written over the...
And by rules, you mean the bridge between legislation and actualization?
Right, because when we do legislation, a lot of it is pretty broad. Yeah. And so there has to be more fleshing out of those laws. So they are done by what's called administrative rules. And then there's a committee that the department brings those rules to, and it's a legislative committee, and they say, does this meet the intent of the legislation? Those have been developed by the Department of Public Safety, and I was involved with them. I kept reviewing them as they went along.
And this is so people can access medical marijuana?
This is allowing for up to 4 dispensaries. It would be grow facility and dispensary, very tight security and lots of regulations around it. Some people thought it was way too much, but we had 5 applicants. Yeah. So now the deadline for the applications was, I think, 2 weeks ago, and now they're reviewing all of those and talking to the people who've applied, and we'll see what happens.
And moving forward, you'd like to see decriminalization of all use?
I'd like to see decriminalization of the penalties and see it done as a fine, and treat it like you do alcohol, so that if you have, because I do think that kids shouldn't be smoking. I think they're...
Or drinking.
Or drinking, either one. But we already regulate drinking for young kids. Yeah. And if you treated this the same way, so if anybody, and this is the bill that I had last year, if somebody under 21 gets caught with it, it's treated the same as possession of a malt beverage. People over 21, it would be a fine. The fine would, I think the way we wrote it up was, the fine would be, some of it goes to the court system to administer the fine, some of it goes into the general fund, and some of it goes into drug awareness education. So I think that it's a losing battle to try and it just doesn't make sense to me. So
there's been a lot of talk in Vermont and across the country about the obesity epidemic. Is that the role of the legislature to get involved there?
I don't know how we should be involved in that. I was listening to the radio the other day, and they were talking about, in New York, now you can't buy soft drinks, right? New York City soft drinks over a certain amount, which is very nice and sounds reasonable. But the mayor has an air conditioner in the window of his car because it doesn't cool off fast enough. I mean, whose vice are you going to control? But I do think that we need to have some involvement, and I'm not sure what that is. My feeling is it's probably through incentives rather than prohibitions.
And adults modeling good behaviors.
And having better school lunch programs and stuff like that makes more sense to me than prohibiting.
Well, I think it will be something we'll be looking at. Because the negative effects of obesity certainly are something that we're having to deal with now as a culture. So it's one of those things.
And we have hemp, industrial hemp.
That's right.
And so when we come back in January, we'll have a report on how we should get ready, how we should
be ready
do permits,
for it, and hopefully convince the federal government to
I think that we're going to try and convince the legislature in the state of Vermont that we should go ahead and issue permits. And then
are there farmers that are asking for
there
this
are at least 3 farmers in Vermont who are willing to be part of a test case. And the federal government, the DEA has actually taken applications from farmers in other places.
Yeah.
They've cashed the checks. It cost something like $3,500 or something for
A permit?
a permit.
Yeah.
They've cashed the checks, but they've never issued the permit. Don't you think
Yeah.
that's
Curious?
yes, don't you think that's curious? I think it's worthy of a suit, maybe. I don't know. Anyway, industrial hemp would be a great product for Vermont to get involved in.
We're certainly advising farmers to diversify.
Oh, yeah,
And
yeah.
if we can put something else in those opportunities, then it would make sense. And again, this is to clarify, industrial hemp has nothing to do with cannabis.
It has nothing to do with it.
Right.
Yeah. And you know, there are so many. Someday let's have a program, and we won't talk about anything about healthcare or the economy or anything like that. Those big things that everybody talks about. We'll have a list of all the little issues that make a huge difference in people's lives, but that never get any
Well, that's human
publicity.
services for the most part.
Well,
But that is another show. And
Yeah.
we're kind of
But,
running to the end of this one.
there are some things that we passed last year that nobody knows that we passed, and they have a huge impact on people's lives.
We usually entertain between 800 and 1,000 draft bills, and I think we pass 100 or so.
Well, I don't remember how many it was that passed this year. I thought it was closer to 200. I don't remember, but some of them are folded into other bills. So, and some of them never see the light of day. But
You know, what I tell constituents, and especially school children when I meet with them, is that your ideas can become laws. And several years ago, it started with a 6th grade class who wanted to do something to help with global warming, so they started a bill that would prevent school buses from idling while they're at schools, and it became law. And what I tell school children and anybody is, if you have an idea, be in touch with us. If you have a concern, be in touch with us. And as we close, I don't know if you want to give out your contact information. It'll also, I think, be scrolled on the screen, but if you want to say it now, this is a good time.
Sure. My number's in the phone book. It's 387-4379. It's in Putney. And I use my legislative email, and it's jwhite@leg.state.vt.us.
Right.
And all of us use that email address with our first initial and last name.
Yeah.
So yes, you contact us, because that's how we know what. I've put in a number of bills for people. Some of them are successful, and some of them aren't.
Yeah, and that's our job, to represent you.
Yeah.
So, and my contact information is at my website, which is the new website, windham4.net. Used to be Windham 5, and then
Now you're
after
Windham 4.
reapportionment, the district is really the same, just the number's different.
You know, I have a website. It was set up for me a while ago, but I don't know what the address is, and I've never looked at it. I should look at it and update it, shouldn't I?
Yeah.
I know. I'm such a Luddite.
There's a lot to do. But,
I know there is.
Yeah.
I know.
Well, thank you for
If
taking
anybody
the
out there
time.
wants to help me with that.
Yeah. And a reminder, we do all our administrative work like that. We answer all our own mail. We don't have staff to do that, all our own emails. So sometimes it takes a little longer than people might want, but we do get back to you, and we encourage you to be in touch with us.
Yep.
Thanks for taking the time today. And thanks to the
Thank
people
you.
at BCTV
Yes.
once again
Yes.
for putting this together and helping us stay in contact with the people of Windham County.
Great. Yes.
Bye-bye now.
Thank you.